The human body to me is just unbelievable. And so as I started to understand more about how it works and how our body recovers, it kind of led me down the path to medicine. And I think that, trauma in particular, I like the ability to make an impact immediately on a patient. The first time I meet a patient is in the emergency room typically, and it's typically after an accident of some sort or some type of traumatic event. And it's at a time when a patient's pretty vulnerable, and that's the first encounter that we ever have with patients. Most of the time our patients are pretty anxious, they're scared, so trying to get them to relax and take a deep breath for a moment. I like to try to see if I can find some common ground with the patient. Sometimes talking about their family, sometimes an interest that they have, maybe take their focus off of their injuries long enough to get them to gain some trust in me and to allow us to do the necessary things to take care of them. It's always going to be compassionate. It's always going to be my best effort. We can take a situation where someone's very severely injured and help them and see their progress throughout their hospitalization, and then even in follow-up in clinic, and to see the complete recovery of a lot of patients. I feel pretty strongly that patients who come here as trauma patients are in good hands. We have a great team, and I think that we have a great outcome for our patients. We're really interested in making our patients' experience here one of the best they can have under such a traumatic experience. When I can see that we've made a difference and patients and family then say thank you, that can make my day, especially if we've had a hard time in the trauma bay. When I'm not at the hospital, I like to spend time with my family. So I have 8 kids, and I enjoy spending time with my kids, especially time with my husband. We like to be outside as much as possible.